Hi everyone, welcome once again. I'd like to say thank you to everyone that has subscribed to our channel and to all the latest UKRN. Congratulations! And if you're still looking forward to your exam, wish you all the very best. I tell you, OSCE is simple. Just keep practicing, and by the special grace of God, you'll pass your exam at one sitting. In today's video, we'll be looking at one of the community scenario in assessment. We'll be using the MOS chart. That's the Malnutrition Universal Screening Tool chart. Of course, we know assessment is 20 minutes. So now, let's go. Alright, so I check for scene safety. I can see my scene is safe for me to approach. I draw the curtain and close the window to maintain my patient privacy and dignity. I go ahead to perform a hand hygiene following the 7-step technique of WHO for hand hygiene. I put an ampoule of gel in my hand. I rub palm to the back of my hand, vice versa. Fingers interlocked, vice versa. Fingers interlaced to palm. My fingertips in rotational manner, vice versa. My toe in rotational manner, vice versa. My wrist in rotational manner, vice versa. And I allow my hands to get dry for 30 seconds. Now my hands are dry. I'm happy to approach my patient. Assessor, will you please confirm that these equipment are calibrated and safe for use?
Yes.
Okay, so I go ahead to don my apron. And I don my glove as well. So I'm going to be taking my equipment to my patient bedside now. Hello, good morning.
Good morning.
My name is Funke. I'm one of the nurses that will be attending to you today, and I'm here to carry out a full set of observation on you using the A to E approach. And I've got this chart with me as well. We call it the Malnutrition Universal Screening Tool chart, so I'll be taking you through that as well. Is that okay by you?
Yes, sir.
All right. So before we go ahead, I would like to know your full name and your date of birth as I confirm with the chart in my hand.
My name is Hannah Brown, and I was born on the 4th of December 1975.
Oh, how do I call you, please?
Call me Anna, please.
Oh, what a lovely name, Hannah. Anna, can you tell me your address?
I live in 10 Blackpool Avenue.
Oh, thank you for letting me know. If I may ask, have you got any allergy?
Yes, I'm allergic to apixaban.
Oh, sorry to hear about that. And when you take apixaban, what happens to you?
Vomiting, and I sometimes get skin rashes.
I'm so sorry to hear about that. And I want to assure you that I will not give you anything that contains apixaban while you're under our care. Is that okay?
Yes, no.
Oh, how long have you been resting, Anna?
I've been resting since this morning.
Oh, that's beautiful. And Anna, can you hear me well? Can you see me clearly?
Yes, nurse.
Oh, okay. And if I may ask, are you in any pain at all?
Yes, I've got this suprapubic pain.
Oh, sorry to hear about that, Anna. If I ask you to score your pain on a scale of 10, with 0 being no pain and 10 being the highest pain, what will you score your pain?
A 6.
Oh, so sorry about that. Do you mind if I just reposition you, just put this pillow a bit backward? Is that okay?
Yes, sir.
Oh, all right. So, Anna, I'm going to be checking through your math chart after this procedure to see if you are due for any analgesic. I'll be administering that, and if not, I will escalate to the medical team to prescribe one. And I can as well refer you to the pain management team for further plan of care. Is that okay?
Yes, no.
All right. So, Anna, I'm just going to go ahead now with your observations. I'll be starting with your blood pressure. Can you please ensure that your legs are not crossed? And when I start inflating this cuff, you can feel some tightness, and but as soon as it starts deflating, you wouldn't feel any tightness again. Is that okay?
Yes.
Is it okay if I use your left hand, Anna?
Yes.
Right. So I'm just checking the left hand. I can see there's no skin lesion, no inflammation. There's no cannula on this hand. So I'm happy to use your left hand. So I can assure you that I've got the right size of cuff here. So I'm going to be wrapping the cuff on your upper arm, covering 80% of your upper arm, 2 to 3 centimeters above the antecubital fossa, and make sure that the cuff is not too tight, neither is it too loose. Okay, so I'm just going to be starting the monitor right away. Okay.
Yes.
All right, so that's it. And your blood pressure reading is ready, so I'm just going to be unwrap. I'm going to be I will wrap this cuff. Okay. So I unwrap the cuff. And Hannah, I will be checking your heart rate now, and I'm going to be silent for 2 minutes, and I want you to be silent for 2 minutes as well. Is that okay?
Yes, nurse.
All right, so I'm trying to locate your radial pulse now. All right, so assessor, my time starts now. So I assume 2 minutes has passed. Anna, I've counted your heart rate for 1 full minute, but I'm so sorry, I also counted your respiratory rate for 1 full minute. I didn't tell you earlier because I didn't want you to get anxious, because that can alter the value. Is that okay by you?
Yes.
Okay,
nurse.
thank you very much, Anna. Anna, I'll be checking your oxygen saturation, but before then, I'll check your capillary refill first. So I'll be using this middle finger. So I'm checking. There's no nail polish, there's no false nails. So I'll be depressing your nail bed for 5 seconds. 5, 4, 3, 2, 1. Your capillary refill is less than 2 seconds. So I pull the oxygen saturation probe, the pulse oximeter, to check your oxygen saturation, and that is it. That's done already. I'll be checking your temperature now. I'll be using the infrared thermometer. I'll be pointing it on your forehead, Anna, and you hear a bleep sound. It's just the temperature reading. Is that okay?
Yes, nurse.
I can see your forehead is not sweaty, so I point the infrared thermometer, and that's the reading now. So I'm done with your observation. With your airway, and now your airway is clear, you can make a full sentence, so I'm happy with that. And with your breathing, I counted your respiratory rate for 1 full minute. I was looking out for the rate, the depth, and the rhythm, and everything is normal. Your respiratory rate is 20 breaths per minute, which is within normal range. I also check your oxygen saturation, and it's 97%. That's fine as well. And I can see the rise and fall of your chest. There's bilateral rise and fall of your chest. I couldn't hear any stridor, so I'm happy with your breathing. And moving to your circulation, I check your blood pressure. Your blood pressure is 130/85 millimeter of mercury, which is fine, within normal range. Your heart rate is 82 beats per minute, and your capillary refill is less than 2 seconds. They are all within normal range. For the heart rate, I was looking out for the strength, the rate, and the rhythm of your heart rate, and it's absolutely fine. With your disability, I can see that you are alert, and when I came in, you said you can hear me well, you can see me clearly. If I may ask, when last did you pass water? When last did you have a wee?
20 minutes ago, nurse.
Oh, that's beautiful. Assessor, can you please tell me my patient blood glucose level? 9.2. Oh, all right. Thank you for letting me know. Hannah, your blood glucose level is a bit on the high side, but you don't have to worry about that. We'll keep an eye on it. We'll keep monitoring it. And if there's any need for us to escalate to the medical team for a medical intervention, of course, we're going to do that. Is that okay by you?
Yes.
Can you wiggle your legs for me? Oh,
Sure.
done. Oh, thank you very much. I will be talking about your exposure now. I checked your temperature earlier, and your temperature is 38.2. That's a bit on the high side. Do you mind if I take this extra blanket off you?
No, nurse.
Oh, I need to take the blanket, Hannah, so that we can bring your temperature to normal range, if you don't mind, Hannah. Should I take some of this blanket, Hannah?
Yes. nurse.
Oh, okay. So I've removed some of the blanket, and if you don't mind, I can get you a fan as well. That will to cool you down. Is that okay?
Yes.
All
nurse.
right. So I can see on the exposed part there is no wound, there is no skin lesion, no injury. If I can confirm, Anna, do you have any wound or any injury on the unexposed part?
No, nurse.
Oh, that's good to know. And with your past medical history, I can see here that you have been diagnosed with DVT in 2015, and you got COPD as well, and you are also type 2 diabetic. Is there any other past medical history you'd like me to know of?
No, nurse.
Oh, that's good to know then, Hannah. Hannah, I'm just going to be stepping aside now. But before I step aside, like I said, I've got this must chart with me, so I can see that your name is well documented. So this is the chart for Anna Brown, and for step 1 you got a BMI score of 1, meaning that your BMI score is between 18.5 to 20, and for step 2 you've got a score of 2, which means that you've lost more than 10% of your weight in the last 3 to 6 months. Anna, is this intentional?
No, nurse.
If I may ask, what is the cause of this weight loss, Anna?
I've lost my appetite for some days now. nurse.
Oh, Anna, I'm so sorry to hear about this. Anna, I want to just encourage you to be eating Small meals at frequent interval. Or do you have any food preference, Anna?
No, nurse.
Oh, okay. So, Anna, if you don't mind as well, I'll be referring you to the dietitian for further plan of care. They will help you to plan your meal as well. Is that okay?
Yes, nurse.
All right, that's beautiful. And for step 3, you got a score of 0. So you have a total more score of 3. So I'm going to be stepping aside now, and I'll come back to interpret all these things to you. Is that okay, Anna?
Yes, nurse.
All right. So if you need me, just give me a shout. Okay, either me or any of my colleagues will be coming around just to check up on you if you need us. Okay, so I remove my apron and I discard in the clinical waste bin. I perform my hand hygiene following the 7-step technique of hand hygiene by WHO. All right, so I'm going to be documenting on my chart now. So I take the news chart, the name of the patient, the date of birth, date of admission has been prefilled. I write the date, I write the time as well. And for the respiration is 20. So I write 20 in the box, and that's a score of 0. The oxygen saturation is 97%. I'm using scale 1, so I write 97%, and that's 0 as well. For air oxygen, Anna is on air or room air, so I put capital letter A, and that's a score of 0. For the blood pressure is 130 over 65 millimeter of mercury, so I'm charting that as well. I'll be scoring the systolic, so that's a score of 0. For the heart rate, it is 82 beats per minute, so I write 82 in the box, and that's a score of 0. And for the D part, the Anna is alert, so I put capital letter A, and that's a score of 0 as well. And for the temperature, it is 38.2, so I'm going to put 38.2 in this box, and that's a score of 1. So the news total is 1. Monitoring frequency, I turn to the back of the chart. The monitoring frequency for a score of 1 is minimum 4 to 6 hourly. So 4 to 6 hourly. Escalation of care, yes, I'm going to escalate. I put Y, and I put my initials as well. And for the most chart, is a total most score of 3, so I write 3. The date, I write the date. I put the time as well, and I put my signature. So that's done now. I'm going back to Anna. I perform my hand hygiene again, following the 7-step technique of WHO for hand hygiene. Hi, Hannah.
Hi.
I'm back. Are you okay?
Yes, nurse.
All right. So for your news chart, you've got a news score of 1, which means we'll be monitoring you every 4 to 6 hourly, and I'll be informing the registered nurse about this. And if there's any need to escalate to the medical team, we do this. We do that as well. And for the most chart, you've got a score of 3, meaning you are at high risk for malnutrition. So Anna, like I said earlier, I'll be referring you to the dietitian for further plan of care, and also you can include some fruits in your diet as well. That will help to boost your appetite. And for the most chart, we'll be monitoring you every week to see how you're improving. Is that okay?
Yes.
All right. So Anna, before I go, I'll just be asking you some other questions. Do you have any problem with your sleeping pattern?
No, nurse.
Okay. Any problem with your mobility?
No, I'm independent.
Oh, that's good to know. And with your elimination, have you got any concern? Have you got any
Yes, I've
concern?
been urinating frequently, and I don't know why.
Oh, I'm so sorry to hear about that, but it's just because you have urinary tract infection, and of course the medical doctors are aware about this. They'll prescribe some medication for you, and that will help to will be able to get rid of the UTI in no time. Is that okay?
Yes, nurse.
All right. So Hannah, if I may ask, are you religious?
Yes, I'm a Christian.
Okay. And is there anything you want me to know about your sexual life?
I don't want to talk about it.
Oh, I can understand, Anna. And for your psychosocial history, I can see that you work as an administration assistant. You enjoy watching television. I enjoy watching television as well, Anna. And I can see you live with husband in a 2-story house. You had amputation previously on 2 of your toes on the right foot, and you use crutches. Yeah, but you said you're independent, isn't it?
Yes, nurse.
Okay, so and I can see that you smoke 25 of cigarette per day and binge drink on weekends. Have you talked about quitting smoking and alcohol, Anna?
Yes, nurse.
Oh, that's beautiful. So I'm going to be referring you to the smoking cessation team as well as the alcohol cessation team. And I can see here, Anna, that you have not been compliant with your diabetic diet. I know it's difficult, Anna, but you just have to do this for now, okay? You need to be compliant, Hannah. So just try to be compliant. Is that okay?
Yes, nurse.
All right. Thank you so much, Hannah, for your cooperation. So if you need anything, Anna, just give me a shout and somebody will be here to attend to you. But after you've been discharged, have you got your GP number?
Yes, nurse.
Oh, that's beautiful. So if you have any concern after your discharge, you can always ring your GP. And in case of any emergencies, you call 999. And for non-emergencies, you call 111. Thank you so much, Hannah. Have you got any question for me?
No, nurse.
Oh, thank you so much. So I'll be leaving now, and I will ensure that I make clean all the equipment I've used. And I'm going to be performing my hand hygiene following the 7-step technique of WHO for hand hygiene. I put an ampoule of gel in my hand. I rub palm to palm to the back of my hands, vice versa, fingers interlocked, vice versa, fingers interlaced with palm to palm. My fingertips in rotational manner, vice versa, my thumb in rotational manner, vice versa, my wrist in rotational manner, vice versa, and I allow my hands to air dry for 30 seconds. Thank you so much for watching, and hope to see you soon.